Hi everyone, good Monday afternoon and welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. Thanks for tuning in with us as we provide you with a daily coronavirus update from Dr. Michael Fine, the former director of the Department of Health here in Rhode Island, heavily involved in the medical community. Finger on the pulse. Dr. Fine, thank you for joining us today.
Nice to be here again.
Well, I want to start internationally with the response before we get really down locally here. Let's take a look at Italy, for example, quarter of the country under self-quarantine. Obviously, we've seen what's taken place there in other countries around the world. Do we have a sense that the global community is getting a good grip on this at this time? And maybe we start with Italy as an example. Will these self-quarantines, in your estimation, prove to be effective?
Well, they've been pretty effective in China. Now, that's not all self-quarantine. There's government enforcement of that. But if you look around the country, around China, only in Wuhan are cases increasing. And the rate of increase has dropped radically. So they're now getting only about 40 new cases a day. They were getting thousands a week ago or 3 weeks ago. And what's really interesting about China is the disease doesn't appear to have spread to other cities if what the Chinese are telling us is the truth. So it looks like what's called social distancing, really restricting movement. It looks like that's really working in China if the Chinese are telling us the truth.
And let's talk a little bit about that self-distancing, self-quarantining. Of course, internationally down to the local level, we are seeing a lot of that distancing. Events being canceled, really keeping people out of public spaces. Let's talk a little bit about that, Doctor, in terms of the efficacy, and then, addressing it here really, again, these beginning stages. Will this be protracted? Is it a wait and see to see if these are, in fact, again, sufficient measures to address the spread of coronavirus as we're here in the middle of March?
I don't think we know the answer to that. Obviously, the Chinese example is a good one. But we won't really know the dynamics of this outbreak until we start broadening our testing, until we start testing a lot more people.
Okay.
And start testing to tell us about new cases. Right now, we're only testing people who have traveled from a foreign country and one of the countries at risk and have symptoms. People who are contacts of those and have symptoms. That's a pretty narrow band. So we've actually only tested it, at least according to the Department of Health reports, about 42 Rhode Islanders.
Yes.
I suspect that if we start testing, when we have the resources we need to start testing more people, we may find more disease, not only in Rhode Island, but also around the country.
So let's talk a little bit about that dichotomy, Doctor. Of course, we heard from President Donald Trump just a couple days ago telling the American public tests will be available to those who want to take it. Now, here in Rhode Island and, of course, around the country, we've heard the message has been only the most severe case to contact the Department of Health. Of course, don't go to public hospitals or health clinics. Again, call them to have them come to you and tell you where to go. What's that going to look like if there is a softening of those rules, if there are, in fact, more tests available? From a purely medical standpoint, of course, there's so much concern right now. Even folks with, a mild cough might say, I'd really love to get tested. What is your recommendation from the medical field? Again, if we do see more tests available, and you don't know if you've been in contact with someone with coronavirus, clearly those who know people who had traveled, again, to Italy, the case of the school trip here. But tell folks a little bit about your advice and recommendations.
So the first thing is, for most people, this will be a mild disease, a cough, maybe a low-grade fever, and some sniffles or sneezing. And we have no treatment and no vaccine. So testing doesn't get us anyplace for most people. It doesn't help us address the needs of the people who are ill. People who are mildly ill should by and large stay home. Going to the doctor isn't going to help them. And it actually may spread the disease if they turn out to have the disease. when we get access to more testing, and I think the challenge has been access to the resource, we don't know when those resources are actually going to arrive on the ground. But when we get more access to more testing, that testing is for us, not for you. Is to say it helps our Department of Public Health and the CDC understand the dynamics of the disease and how widely spread it either is or isn't. But it doesn't help the individual very much at all. For people who are seriously ill, and hopefully there will be only a few of those, if any, but for people who are seriously ill, a test helps us do two things. First of all, if we know it's coronavirus, we don't have to start looking for other causes of serious respiratory illness. And then it helps us know that the disease may be in the community if we're seriously ill and aren't one of the people who are in an identified high-risk group.
And so let's talk a little bit about the response, of course, after taking a coronavirus test, those 3 cases here in Rhode Island, one of whom is hospitalized. Now, of course, the doctors say that this is unique in the way that it attacks lung receptors. So let's talk about those severe cases. What is done from a medical standpoint, doctor, when someone who's tested positive for coronavirus is in such a state that needs medical attention? What is that medical response and what does that look like for that individual?
It's supportive care, and no different than the care anyone with a severe pneumonia or severe lung disease will get. The fact that it's caused by COVID-19 doesn't change what the treatment, which is making sure the person gets enough oxygen and making sure they get enough fluids so that they can recover.
Do you have the sense, you were director of Department of Health, the state's capacity for those severe cases? Are we well equipped with acute care beds and treatment, if you will, if we were to see, again, more significant cases arise who, as you said, needed that acute care in the way of a pneumonia? Let's talk a little bit about those numbers. Is Rhode Island, again, equipped to handle something on a large scale?
We're equipped to handle something on a reasonably large scale, but like anything else, it depends on the actual scale. If we get an extra 20 people in an intensive care unit, I'm certain we can handle that. But if we were to get thousands, that would strain our capacity.
So let's talk a little bit again about around the country. Some reports this weekend, national news sources pointed out communities in need, low-income communities in particular, facing a particular challenge with coronavirus, and from a number of facets. From densely populated areas where people are in contact, especially within cities, the information getting out about how to protect oneself, and then of course the economic impact if there's a self-quarantine. How would the Department of Health, having been at the helm of it here, doctor, begin to address that here in the state? At a recent press conference, the governor did say that she's very much looking closely, again, on those economic impacts for those folks whom a self-quarantine would put a strain on the family. But, addressing the state's residents most in need, how does the Department of Health begin to approach that?
First of all, this Department of Health is exquisite at its ability to work with Rhode Island's communities and has lots of contacts across the state through the health enterprise zones and through relationships with community organizations, with pastors and ministers and imams and rabbis, many others, to be pushing a message out. It's still a challenge to get these messages translated into both Spanish and Portuguese, and I pay particular attention to the Cape Verdean community. We have one of the largest Cape Verdean communities in the nation by proportion of population, centered in Central Falls and Pawtucket. So there are about 10,000 Cape Verdeans in Central Falls and Pawtucket, 20,000 Cape Verdeans in the United States, or in Rhode Island, and that community is a community we want to pay particular attention to in terms of making sure people get the messaging in both Portuguese, Spanish, and Cape Verdean Creole where we can. So that's on the messaging side. On the economic side, I think the risks are greater. Because though we now have some universal sick time, it's not very expansive for people who have to self-isolate for 14 days. Many people, at least in Pawtucket and Central Falls, and in Rhode Island as a whole, can't miss a paycheck. Financially, it's just too much strain. And those are people who we need to figure out a way to pay particular attention to. If we get to closing schools, as other states and nations have done, that puts a huge strain on people who are working and may or may not have childcare. So I think there are things that are way outside the purview of the Department of Health that we should be doing, which is things like looking at emergency TDI or some kind of emergency funding for people who are going to miss work because we need them to protect the public. I think we need to be thinking about emergency Medicaid for people, what's called presumptive eligibility, for people who may be at risk for losing their health insurance if they have to spend a month out of work.
Mm-hmm.
And I think we also ought to make sure we extend the period where utility cutoffs are prohibited to make sure that people whose cash flow is cut off or reduced don't lose their gas, electric, their power because of this disease.
So you talk about, obviously, these emergency powers and provisions, if you will. We have seen some states, Doctor, of course, declare states of emergency. Talk with us a little bit about that. At what level, at what point does a state need to say this? We need to declare this from a procedural standpoint, and what does that entail for the community and for the providers if that declaration of emergency is made?
States have each state has a different set of rules about declarations of emergency at the state level. There's a federal process, but states have their own internal process, and it gives different states different kinds of powers and authority, which then give the governor and the executive branch more authority than they used to have to isolate people, to do things like close schools. I'm not sure I know what that would mean in Rhode Island, but it does help, sort of consolidate power and get things done that we think we need to do to protect the health and safety of all Rhode Islanders.
So, Doctor, this afternoon, anticipating another press conference here at the Department of Health. Now, as we mentioned, the numbers still 3 positive cases here identified. Again, those testing numbers, as you said, around 42. What to keep an eye on moving forward, Doctor?
Well, I think we want to keep an eye on whether we expand testing or not, because what we still don't know for sure is whether the assumption that we proceeded with, that the only people who can transmit disease are people with active symptoms, we don't know whether that's accurate or not. There are reasons for thinking it's not.
Okay.
So the first thing I think we ought to look for is the expansion of testing. And then if we get an expansion of testing, and this won't come out in a news conference, I don't think anybody should be shocked if we find we have more cases than we thought we had.
Okay, well, Dr. Fine, former director of the Department of Health here, going to be Skyping in daily to GoLocal Live here in downtown Providence. If you have questions for the doctor, please be sure to contact us, news@golocalprov.com, and of course, see us when we pop up here on Live in Providence. So, Dr. Fine, thank you so much for joining us today.
Thanks, Kate.
And thank you for watching. Again, we'll bring you the latest with coronavirus updates and, of course, more here from GoLocal Live. I'm GoLocal News editor Kate Nagel.